Welcome to the Policy Visibility Drive, a Ghana Health Service policy initiative created to enhance the exposure of policies, manuals, and guidelines within the health sector. In this video, we shall be focusing on the legal and policy framework for health information and health data reporting. In Ghana, access to and the utilization of health services have long been key priorities within the health sector, shaping public discourse and informing health policy directions. Stakeholder accountability has grown over time, driven by increased investments and the imperative to demonstrate tangible benefits, particularly for vulnerable groups. While technological advancements, including the internet, have improved communication within the healthcare sector in Ghana, there remains a substantial opportunity to further leverage these tools for enhanced reporting and health system performance. Key private and quasi-government providers are not yet routinely included in performance reporting. Information management systems continue to evolve, and mechanisms for data validation and quality assurance could be further strengthened. These dynamics highlight the need for a strengthened legal framework governing information generation and reporting in the health sector, including issues of privacy protection and standards for technology-enabled health services, striking a balance between the imperative to gather and disseminate accurate health information and the need to protect individuals from potential harm remains a key consideration dilemma in the evolving regulatory landscape globally. This video examines the legal framework relevant to the creation and use of health information in Ghana. The health sector information system in Ghana is primarily focused on routine data collection to support operational management within each administrative unit. It collects data on input, process, output, outcome, and impact of services, covering clinical care, public health, financial management, human resources, and logistics management. This information is organized at 5 levels: community, sub-district, district, regional, and national. At each level, there are specific responsibilities, from primary health services at the community level to strategic planning and policy development at the national level. The sector-wide indicators and reporting formats streamline data submission to higher levels, promoting accountability and efficiency in reporting. However, opportunities remain to strengthen reporting completeness, broaden the inclusion of key providers, and accelerate the adoption of digital technologies. Overall, the system seeks to balance the need for accurate health information with the protection of individual privacy, particularly in the context of evolving digital technologies. The health information system is characterized by multiple data collection tools, many of which are developed within the public sector with limited coordination across other healthcare providers. This has contributed to fragmentation, duplication of reporting efforts, and gaps in certain data sets. In addition, capacity constraints and perceptions of limited utility at lower levels of the system may affect reporting commitment, with a tendency toward program-specific rather than integrated reporting. These challenges underscore the importance of strengthening the policy and regulatory environment governing health information management and reporting. Effective management of individual health records is essential for protecting privacy and supporting informed decision-making at all levels of the health system. However, increasing computerization introduces considerations related to privacy protection, particularly in relation to the use of identification numbers in individual health transactions. Balancing the benefits of comprehensive health information with privacy protection remains an important consideration in the context of evolving digital systems.
If you've liked this video so far, give it a thumbs up and subscribe to the official YouTube channel of the Ghana Health Service. Comment down below as well to let us know what you think, and click the card above to view all Policy Visibility Drive videos.
The main objective is to strengthen ethical standards for health information reporting within and across the levels of health administration in the country. Specifically, the framework shall Guide the development of internal structures for the collection, storage, and reporting of health data and health information. Specify the type and content of data to be reported by all providers in Ghana. Define responsibilities and reporting mechanism and schedules to be applied to all health data. Define situations and the extent to which health information can or must be disclosed to patients, healthcare providers, government, and other stakeholders, and where authorization is required. Prevent abuse of health information and establish penalties for misuse. Safeguard privacy of health information through the appropriate use of identifiers and data governance mechanisms. The legal framework aims to define health information comprehensively, encompassing data about individual patients, populations, intervention outcomes, and the state of infrastructure. It classifies health information broadly into patient management, facility management, and health systems management. Another classification includes clinical, administrative, and public health information. The framework seeks to address concerns by providing sanctions for improper possession, disclosure, or sale of health information, especially regarding privacy standards. It establishes rules for information practices, facilitating the creation of databases at various management levels within the health sector. The framework also outlines approaches to health information generation and use. The legal framework for health data management encompasses several key principles. It emphasizes that data collected by the health sector should, where appropriate, be de-identified or appropriately protected. Adequate standards for data storage are highlighted, addressing concerns about physical security and unauthorized access, especially in computer-based records. Internal use of medical data should align with its original purpose and any additional lawful or consented uses. Due to the sensitivity of medical data, disclosure to third parties should be restricted unless a clear and authoritative reason exists, and care should be taken in communicating relevant information during referrals. The framework recognizes that while health records are managed by institutions, individuals have legitimate interest in their health-related data. Lastly, considering the volume and relevance of patient history, the framework advocates periodic summarization and appropriate archiving or retirement of historical records to manage the increasing volume of information generated over time. In Ghana, the existing legal and regulatory framework provides limited explicit provisions addressing health information governance. International experience, however, highlights the importance of comprehensive legislation in strengthening privacy protection and supporting effective health information systems. The proposed framework seeks to strengthen the health information system to better support knowledge generation and evidence-informed decision-making through enhanced stakeholder collaboration.
Please note, this video only contains an abridged version of the policy document or publication. To access the full document or for further reading, kindly visit the Ghana Health Service website at www.ghs.gov.gh. Thank you for your time and attention.